MyHealth Access Network presents Dr. David Kendrick speaking about the confluence of available federal, state, and local opportunities.
There are a number of exciting things going on both at the federal level and at the state level and in our community that are unique opportunities for an organization such as MyHealth Access Network. And those opportunities are, probably one-time opportunities at this point. And so they're critical to understand, to evaluate, and to participate in if we can. Among those, let's just start locally. Because there's funding put forth in the stimulus legislation to encourage the growth of health information exchange in states, we have something called the State Trust, or the Oklahoma Health Information Exchange Trust. And that trust has about $8 to $9 million in funding to encourage the adoption of healthcare IT and health information exchange in this state. And that organization has determined that the most effective way to use those funds is to encourage the growth of existing health information exchanges, of which we have 2 in Oklahoma. And so they're releasing a voucher program wherein a provider in the community or a hospital in the community, especially in rural areas, can join a health information organization, which is certified health information organization, certified by the trust, and has 90 days to get connected. And if they get connected within those 90 days, then the trust will pay a voucher to that health information organization on behalf of that provider or hospital to offset the cost of the connection. And this is a very positive program in my mind because it really will help us to rapidly deploy the effort, and that's really the first step. The other innovations, I think, are particularly adept at helping drive adoption of the tool once it's deployed. So I think that's how these sort of function in a series. For example, the 3026 waiver program, which is focused on building some community-based infrastructure to help reduce 30-day readmissions, specifically among Medicare patients, but one can see how it translates to all types of patients. And this opportunity is put out there by CMS, and interestingly, it does require an organization just like MyHealth Access Network, that it be community-based, that it have multiple hospitals in participation, that it have those patients involved in governance as well, and that it have the capability of dealing with patient information and supporting efforts around care management and care coordination. So it's as if our Beacon community effort has constructed the infrastructure for this 3026 program, and we're in the process of filing our application now to earn one of these 3026 waivers, and the partners in that effort are all of the hospitals. We have about 35,000 Medicare discharges a year from those hospitals that will come under the application, our 3026 application. And this has a particular importance because it takes us from this infrastructure component that is new enough that not everyone is sure they understand how to use it or what effect it will have for them, to the level of a direct, concrete application of that tool, which the hospitals are very clear on what this program will do for them, because they will eat the cost of every 30-day readmission before too long. And this program will help to reduce that for them. So it has a direct benefit for them, and I would say it's the health information exchange applied is what it really amounts to. So that's the 3026 program. Then there's another one called the Comprehensive Primary Care Initiative, and in our community there were several hospitals really considering becoming accountable care organizations in the first round. As things have evolved, as the policies have been released, they've all reconsidered, and none of them were in the pioneer round. That makes this opportunity with the comprehensive primary care effort ideal for us. Particularly as a health information organization, we have the largest payers in the region, including Medicaid, participating in our effort. And the Comprehensive Primary Care Initiative is basically a multi-payer program wherein several payers in the community, hopefully covering about 80% of the covered lives in the region, apply for this program, and they commit to 5 principles of comprehensive primary care, and they commit to implementing those 5 principles into their reimbursement models. And if they do that, then CMS is committed to coming to the table with additional payments for Medicare patients to the tune of about $20 per member per month. And that's significant funding in a community the size of ours. Providers, people who provide the health care, the doctors, the nurses, the clinics, and so on, are faced with a real challenge in improving health because we serve patients who have many different payers, who have many different insurance plans. And each one of those insurance plans wants to get the most bang for the buck out of the providers, out of the services they get. They want to ensure utilization is appropriate, and they want to get high quality care. And each one of those payers comes up with a different set of programs to achieve that. And in a practice where you have maybe 50 different insurance plans being accepted, the provider has no idea how to implement a specific program for a specific payer. And so this comprehensive primary care opportunity is ideally suited to unifying the requests of the payer, to unifying the programs, so that in my practice now I can have one flavor of patient-centered medical home, one flavor of care quality metrics that I'm following and activities that I need to do to coordinate care, and know that I'm serving all payers with the needed service. And in the end, that's the intervention that will be successful, and patients will actually begin to benefit. So that's the importance to me of the Comprehensive Primary Care Initiative. Then, of course, the Healthcare Innovation Challenge is one that every community, I'm sure, is looking to help them take things to the next level. From our perspective, Beacon, coupled with the voucher program, is helping us to really get things launched and out there, get the infrastructure in existence. And the Innovations Challenge for us really is an opportunity to scale these interventions. That is, to make sure that they're used well, to make sure that the incentives are aligned on the business side. That takes much longer than just launching technology. And getting incentives aligned from the purchaser to the payer to the provider so that these interventions take hold and are done well by providers, which is the goal for all of us, is really the way we intend to use the Innovation Challenge.
Thank you for your interest in this podcast. For more information about MyHealth, visit www.myhealthaccess.net.